We now turn our attention to the area of health, which was rated by 18% of the total respondents as their most important issue area. For background, the Silicon Valley Latino report card told us that 75% of Latino adults are overweight and 13% have been diagnosed with diabetes. Additionally, a California health survey done in 2012 found that approximately 20% of Silicon Valley Latinos did not have health care insurance as compared to 10% of non-Latinos. Recently, the Affordable Care Act, or Obamacare as it's commonly known, provided health care coverage to thousands of Latinos in California. Yet many Latino families remain unable to access that new benefit due to their immigration status. One survey respondent's quote speaks directly to this issue when she stated, "I don't have health insurance. I have a bad hand injury. I can't bend my fingers without pain, but I don't qualify for Obamacare. I don't go to the doctor because the bill is too high." Now, the issue of immigration status and health care coverage will be something I discuss shortly with our next commentator. When it came to health care, we presented the respondents with 5 solutions for their rankings. They included improving health insurance access, improving availability of healthy food and promoting exercise, reducing Latina teen pregnancy, providing support and assistance to people with chronic diseases, and improving access to dental care. From these top options, the top solution selected by respondents was to improve access to health insurance. We did find a difference among respondents based on income levels when ranking health solutions. Respondents with higher incomes were more likely to indicate that they preferred health solution was improvement in healthy food options and promotion of exercise. In comparison, lower income residents preferred either improved access to dental care or support and assistance for people with chronic diseases. It is now my pleasure to welcome Rocio Luna, Division Director for the Santa Clara County Public Health Department. Rocio, please share with our audience what your responsibilities with the county are.
Sure. Ron, I oversee community health assessment activities and planning activities that include a variety of data collection methods throughout the county to get a better sense of the health profile of the communities in Santa Clara County, and also to identify community-driven priorities.
So what is the status of health in Santa Clara County in general, not just for the Latino community? Are we a healthy community generally? Are there gaps?
There are gaps, but overall, generally, we're a very healthy community. In fact, I think we rank in the top 5 of the healthiest counties in Santa Clara, in the state. So we are health, but there are segments of our population, the Latino community being one of them, where we have significant health issues and health disparities that we need to address.
And the issues faced by Latinos in the health area, are they faced by other minority groups, the Vietnamese community, or African American community, or other immigrant populations that you might know of?
Latino community is sort of a standout. The Latino community and the African American community disproportionately are burdened by a variety of health conditions. Diabetes, consistent with the report, diabetes, overweight, obesity, certain other chronic conditions, cardiovascular issues. The African American community is fairly small, so those issues, don't stand out as much compared to the Latino community, which is a fairly large community in this county. Yeah.
Now I know that you and the County of Santa Clara have done a number of health surveys and studies that you mentioned earlier. How do you find, or how did you find the data in the Voices of Change report to be either consistent or inconsistent? Were there any surprises based on your past study of health in Santa Clara County?
Sure. I found that the findings were fairly consistent with other county studies that we've done here, and actually consistent with other studies across the country, for that matter. Latinos still have a disproportionate share of chronic conditions. The report spoke to that, obesity being one of them, particularly in adults. Our youth are still not exactly at healthy weight. They don't meet all of the physical fitness requirements that are standard in schools. Latinas have very high rates of teen pregnancy. Even though those rates are coming down across the nation, we still have a very high rate of Latino teen pregnancy in Latinas.
Okay. Now, if I'm going to be the genie. I come out of the bottle, I'm going to give you one wish. And your wish is to be used on ridding Santa Clara County of the biggest health illness for Latinos? Would it be obesity or diabetes or other diseases that may be more important?
Actually, in my opinion, I would say that the highest concern for the Latino community is the access to health insurance.
Okay.
Latinos in this county have the highest rate of uninsured, and particularly immigrants, those that are foreign-born, have even lower rates of health insurance coverage compared to those born in the U.S. And we know that immigration status is a significant barrier to health insurance, and even in the wake of the Affordable Care Act, recent studies by UCLA and the UC Berkeley put that number at about 1 million for the state of California, and that number actually for Santa Clara County is somewhere between 140,000 and 180,000 people that will remain uninsured as a result of their immigration status.
Now, speaking of that issue, and you saw the quote just a few seconds ago from one of our respondents talking about the fact that he or she does not have health care insurance. What is the county doing to help those types of residents in our county?
Sure. Well, we are incredibly fortunate in this county that we have a very strong public health healthcare system in this county that is dedicated to the health and well-being of all of its residents, regardless of ability to pay or immigration status. We are also fortunate to have a very strong and committed community health network system where those issues are really not important. We still will provide the health care needed. And CBOs and foundations across this county have also taken a very strong position to ensure that children, and particularly children, go without at least basic coverage. And while the options for adults is somewhat limited, we still are dedicated to finding resources, whether they be federal, state, or local, to ensure that those healthcare needs are met regardless of immigration status.
And you use the term CBOs, that is community-based organizations,
yes,
or a part of this network
yes.
that you've created. Now, I know that years ago, and it still may be the case, that Santa Clara County also had a program that provided free health insurance for children under 18. Is that program still ongoing?
That's still ongoing. We're still dedicated. We don't know how long we'll have it, but
Right.
it's still alive and well, and thanks to a lot of support from various foundations and a dedicated board, we're still strongly committed to ensuring that children continue and remain insured in this county regardless.
Great. Well, keep up the great work. We know there's a lot left to be done, and we know that caring for one's health is an individual responsibility, but it's always nice to have the education programs and the health programs that the county provides.
Thank you.
We want to thank you, Rocio, for your comments, and we will return, and you will return later in our program. Next, we will discuss the very important issue of housing.